For our cleanup hitter now, we are pleased to have Regina LaBelle. She is the former Chief of Staff and Senior Policy Advisor with the Office of National Drug Control Policy in Washington, D.C., and worked at the White House for about 4 years. She is going to be talking about how various sectors of the community can try to pull this all together. And she's been listening very carefully to all of the different talks that have gone on today. And she's going to try to help us put a little framework together as we start to think more about the now what. So it's my pleasure to introduce Regina LaBelle.
Thank you, everyone. And I know that this has been a long day, and I've been really impressed by the breadth of everything that has been talked about today. And it's great and a reflection of your community that you had law enforcement officers who could speak about things such as syringe exchange programs, and you had doctors who can talk about the importance of getting people into treatment and about the origins of this issue. So as Dr. Norbaum mentioned, I left the White House on January 20th. I worked for 8 years for the Obama administration in the Office of National Drug Control Policy. And I came to that office in 2009 frankly, without a great depth of knowledge about the #1 cause of accidental death in America. I was the legal counsel to the mayor of Seattle, and when I came to the Office of National Drug Control Policy, I was shocked to hear the statistics. And I was shocked to hear that it caused more deaths than gunshot wounds and traffic accidents. And so what we did over a course of time was really to listen to the people who are most affected by this issue. And we put together a few plans that were implemented around the country. But today I want to talk about what a community-based response to the issue is and how we can continue to address this issue across America, because it's really obviously morphed a lot since we started in 2009. And one thing that we've seen is that what began as an epidemic that was driven by prescription drugs is now increasingly becoming a heroin and a fentanyl problem. And we would say that the main reason it's become a heroin and fentanyl problem is because of drug trafficking, but also because you have a lot of untreated addiction. And as we heard earlier today from Dr. Seppala, untreated addiction has effects on the brain that you need more and more of, or different drugs to meet the same need in your brain. So if I can get, so I want to start first by how many of you have read this book or heard of this book? For those of you who haven't, I would commend this book to you. It's called Dreamland. It's by Sam Quinones. Sam is a journalist by profession. He wrote this book a couple years ago, and since he wrote it, he has gone around the country. He's become a real advocate for families who are suffering from opioid use disorders and families who have experienced substance abuse in their lives. And he talks a lot about community in his book. And I want to read you this quote that he used, because it's really about the shame and stigma and the silence that was really met all across America on this issue. So he said, "When your kid's dying from a brain tumor or leukemia, the whole community shows up. As we heard earlier, the community will show up, they'll bring you a casserole, they'll talk to you about how sad they are. When your kid's on heroin, you don't hear from anybody until they die. Then everybody comes and they don't know what to say." And I raise this because it's part of a community response. We really need to address the shame and stigma that's attached to the issue and attaches to the people who are suffering from it, their families, those who are left behind, and also the people who are in recovery. So in any community response, we need to include the people who are most affected by it. Any effective community response begins and ends with people. It begins and ends with the people who are affected by it, and that means everyone in a community, because as the title of this whole conference is, it's everybody's business, because it is. It's not something that we should hide away in our bedrooms, hide away in our living rooms. It's something that we need to talk about and bring out into the open, and that's why it's so good to have conferences like you're having today, because it allows the community to begin to talk more about it. And I know that you all have done quite a bit already. So it's driven by local needs. And the third piece of this is to do an inventory of the issues, but also inventory of the resources in your community. Your community is rich with resources. We already have heard today how rich you are with resources. So a couple resources to look at when you're developing a community-based response are schools, hospitals, pharmacies. Pharmacists are a very important part of the solution to this issue. Dentists, because they prescribe a lot of opioids. Do dentists know how to properly treat someone for pain without opioids? Do they know how to talk to someone who's in recovery about their pain without opioids? Again, medical community, doctors and nurses are also important parts of the solution. Recovery centers, if you have recovery centers, I heard there are a few in the area. Syringe service programs. Syringe service programs can be a link to treatment. They can provide an important link to treatment because that is a place where people, I'm doing some work in rural America on in syringe service programs, areas of the country that have never had syringe access programs previously need them now because their rates of injection drug use are so high, and with that have come increased rates of Hep C and HIV. So they're actually putting recovery coaches into syringe access programs, into syringe service programs to help guide people to treatment, to build up trust so that people can get the help that they need. Community health centers are obviously another place that can be part of a community-based effort. Treatment centers, faith communities. Another area of the faith communities can be really important in creating safe places for people in recovery also. And there's some work being done in Tennessee to create faith-based recovery communities around the state. And correctional facilities can also be a place to look for community-based solutions. The number one cause of death among newly released inmates is overdose, because people have not used during the time they're in there, and then when they come out, if they continue to have an untreated substance use disorder, they're going to overdose and die. So look for groups that are involved in the continuum of the issue, from primary prevention to overdose prevention, treatment, enforcement, and then recovery. And recovery should include housing, education, and employment. So here are a few examples. Again, primary prevention. You've heard some about this earlier. You're going to have some resources that will be available to you to discuss later today about how to keep young people from ever starting with substance use. I'm going to talk a little bit about that next. Overdose prevention. So preventing overdose can include distribution of naloxone. It can also include identifying signs of an overdose, so the community knows if someone could be overdosing and what to do when they recognize that. In Baltimore, Dr. Lena Wen, who is the public health director there, she is giving, because they have different laws there, so you have to be trained to distribute naloxone. You can get it under anyone can get it, but everyone in the city. She's giving it to everyone in the city and training everyone in the city how to revive someone from an overdose. Treatment access. What's the treatment capacity in your area? And again, it should be evidence-based. For opioid use disorders, the standard is medication-assisted treatment plus behavioral treatment. So what's available in your area? I have a link to the Samsa treatment locator, which was mentioned earlier today. It's findtreatment.samsa.gov. So basically, you put in your zip code, and it will tell you the treatment locations in your area. It will also, they've revised it so that it will say if there's a methadone clinic in your area, if there are buprenorphine waived doctors in your area. So it has the totality of the treatment centers that are available. And then recovery supports. So I want to talk a little bit about primary prevention. For those of us of a certain age, we recall the one on the right, which was "This is your brain on drugs." And the purpose of this, the well-meaning purpose of it, was to scare kids into not using drugs. Unfortunately, there were other ad campaigns that were used that had the exact opposite effect and actually had a boomerang effect when they were studied. We know a lot more about prevention today than we did then. We know what works, we know what doesn't work, we know what could cause someone, a kid, to begin using drugs after they see some certain type of messaging. So the campaign on the left is, or on your right, is the Above the Influence campaign that was put together by the Office of National Drug Control Policy a few years ago. The campaign is has no longer been funded, but the point of it is that it was a comprehensive prevention plan. Because what we know about primary prevention is that you want to decrease risk factors and increase protective factors. And it can't just be, I'm going to give a speech or at an assembly one day and these kids are going to say, wow, that was scary, I'm never going to do that. It has to be parents, schools, the community, giving those protective factors to those kids. Evidence-based preventions can include providing kids with refusal techniques so that kids know if they're at a party and they're offered drugs, how to respond. And in addition to supportive networks. The Drug-Free Communities Coalition was funded by the Office of National Drug Control Policy. You have one in Marathon County has one that had previously been funded, and you're going to hear later on from them. So Drug-Free Communities Coalitions are a national grant program that help local communities build supportive networks to prevent youth substance use. In addition, the Surgeon General's report on addiction was released last year. It was called Facing Addiction, and the website for it is addiction.surgeongeneral.gov. I raise it because it has a tremendous amount of resources for prevention. So if you're a teacher or you're interested in establishing a community-based prevention program, you can go to that website and find in the first chapter, they talk about prevention programming and what effective prevention programming is, and they have links to some of the programs. So prevention involves both, is there a timer person? There you are. Okay, you're very quiet. So prevention includes environmental factors as well. So I know I'm in Wisconsin, and I'm going to say this. Higher alcohol prices reduce alcohol misuse and related harms. And part of alcohol costs include taxes. So raising beer tax will decrease use among young people. But as of January 1st, 2015, 42 states had a beer excise tax of less than 50 cents a gallon. So that's not much, right? And only 4 states had an excise tax of more than $1 a gallon. You could see the taxes that attach to cigarettes greatly decreased youth smoking rates over the years. That was accompanied by a lot of other work that was done, but excise taxes have a preventive effect. It's a policy that you can put into place. The risk factors for early substance use, I think we heard a little bit about this earlier. They're often the same type of risks that occur for other behaviors like violence and truancy. And the factors that protect young people from those risks can also protect them from substance use as well. In addition to prevention programming, some policies that create that increase costs, There's also reducing availability. And I know that previously the law enforcement panel spoke about take-back days. And I want to stress how important they are to getting those prescription drugs out of the home. 70% of people who are misusing prescription drugs get them from family and friends, and usually from one prescriber. So it's a good way. How many of you have prescription drugs that you don't use in your house right now? Okay, so here's what you can do. You can go, I believe this is what I looked on the website, so if someone correct me if I am not right. The Wausau Police Department looks like they have a drop box. You can drop them off there, okay? It's probably 24/7. It's a police department, so drop them off there. Walgreens. I also looked on the website. It looked like they have a drop box at Walgreens. Go there, drop them off. All right, so I know that we just had Take Back Day. Don't keep those drugs in your home waiting for you to use them later or waiting for them to be misused. You can also, and this is what we used to have to do before the laws were changed, if you don't want to go to the police department, if you don't want to go to Walgreens, mix them with cat litter or coffee grounds and put them in a bag and throw them in the garbage. Take the container out, take them out of the container. But that makes it less likely to be misused. It's not great for the environment, but it's worse to have them in your home unused where they could be diverted. So preventing overdose deaths with naloxone. We've talked a little bit about this today. I want to talk about it. Naloxone distribution has expanded greatly over the past 10 years, and CVS and other pharmacies in Wisconsin are able to sell naloxone, make it available to you over the counter. So you could go to a pharmacy and ask to get naloxone for yourself to have in your home, so that if some people accidentally overdose, you could have it available. Public safety agencies are also carrying naloxone. It began with a few law enforcement agencies in 2010. I remember this at the Office of National Drug Control Policy. There was a fellow in Massachusetts, Quincy, Mass., who started carrying naloxone, and because he saw so many people, he felt so helpless, he couldn't do anything with people that he came upon who were overdosing. And so he started that law enforcement carrying naloxone. That's now, as of December 2016, more than 1,200 law enforcement agencies nationwide carry naloxone. So after someone's revived with naloxone, they're then sent to the emergency rooms. In some communities, and I think this was described a little bit earlier today, but there are the use of recovery coaches in emergency rooms is becoming a very interesting and thoughtful phenomenon around the country. So I'll give you an example of two programs. The New Jersey program is in Ocean County, New Jersey, and theirs is a recovery coach program. So working with area hospitals, they're matching a person who overdoses with a recovery coach. And if the patient's willing, they'll work with that person for up to 8 weeks. And in this case, they will send them to free or subsidized treatment. And early in the program, 70% of the individuals who had overdosed agreed to participate. The second example is in Westmoreland County, Pennsylvania, which has since spread to other counties in Pennsylvania. And it's another example of a warm handoff referral system. It began in 2014, and they had a case manager present on site. They received referrals from the RN case manager and social workers. And because of the success of the program, so they had limited time for the case manager. Now they're doing it 24/7. They have a case manager available. And they do an assessment, and they'll find treatment for the person. And they're constantly evaluating this program to see what makes it work better. They've changed it a little bit over time in terms of who makes the referrals. So this is a picture of a young man named Clay Shepard. And we've talked a lot about this. We've had some courageous stories earlier today. And I raised this because Clay was died of a drug overdose at the age of 22, but his parents went public about the cause of his death in their obituary, despite the shame and stigma that was attached to his disorder. And they did this to help others, to tell his story, so that other parents and their kids didn't have to go through what they went through. I'm going to read you a little bit from the obituary. We write this obituary in hope that it may provide an insight to those that need to change their behavior one night at a time. Shepard was the youngest of 4 children. He was gifted with good grades, intelligence, confidence, athleticism, and he appeared to have it all. But he was steered off track when drugs began to creep into his life in high school. He completed treatment several times. But the craving that comes from true addiction was more than he could overcome, his devastated family wrote. So I share this story to try to start the steps to overcome the shame and stigma that his family has felt, and to stop the hiding that we've seen when people pass away from a substance use disorder. That we need to start saying that's what caused the death, so that we can make sure that people. My old boss is Michael Botticelli, who's been in recovery for 20 years, and he has said repeatedly, you can't hate up close. Because when we talk about drug addicts, we think of them in a certain way. We don't think of them in this way. We don't think of them in ways that our families have experienced. So the people, the families and the friends and people who are in recovery all have to be part of this community response. The supporting recovery piece, the community response can include support for recovery, and recovery support can come in many different ways. The faith communities to schools, families, neighborhoods, and businesses. I think that actually one of the things that I have been most impressed about you all today have been the people that you've had on the stage talking about support for recovery, from the recovery organization that you have here to the businesses that are really exemplary for what they're doing to help people who are in recovery, and the recognition that treatment is not an end, it is a beginning, and that we have to recognize this continuum of care that is necessary over the years. So lastly, the one thing I also wanted to talk about was the rigorous evaluation that's necessary. You've talked some about this earlier today or throughout the day. For any prevention programs, the most important thing is to evaluate whether it's working. So drug-free community coalitions require evaluations, so you know if you're working to change youth attitudes, because it is customary that if youth attitudes think that drinking, smoking, tobacco, smoking anything they have a negative image of it, they're less likely to use. So it's important that we evaluate that. It's also important to not only evaluate attitudes, but evaluate whether or not you're decreasing rates of new initiates. Now, the ultimate goal has to be to reduce overdose deaths, and your county coroner will be able to provide this information. One thing that has been very challenging on the national level, so the national data, any national data you see from the Centers for Disease Control and Prevention, relies upon county and state mortality data. And one of the challenges that we have had over the years is that in some cases, people don't want to say if the person died from a heroin overdose. So the data are somewhat flawed, but we also, I believe, are underestimating the number of people who could be dying from fentanyl, because until last year, the most coroners didn't test for that. So we're getting more accurate data that can help drive a solution to the issue. So find out what your county coroner is doing on this. On naloxone distribution, it's important to track how often reversals are occurring, and also to see if the naloxone is working if you're seeing more fentanyl, if it's continuing to work, if you're using more naloxone to revive people. Use hospital, medic, and police reports. The medics have great data on also because they are accustomed to reviving people with naloxone as well. Engage with hospitals to determine how many overdose reports are coming in. And if you have a treatment referral system, keep track of the numbers of people being referred to treatment. Check on the number of data wave physicians you have in your community. So physicians who can treat people with buprenorphine. How many doctors are seeing and treating people with substance use disorders in your community? And then work with law enforcement, who often keep statistics on indicators that can help determine trends. It was interesting to hear from law enforcement earlier when they were talking about the issue of meth, that they're seeing more seizures. So if law enforcement's seeing more seizures, that's something that is important to communicate to the treatment community, to the prevention community, to the rest of the community. Because that, if you're seeing more seizures, that could show up. So you might see that. And obviously you treat meth addiction differently than you treat other types of addiction. In short, just as you have a community needs assessment, it's important to consistently and regularly follow up to determine what's working and revise as is necessary to meet your goals. Thank you again so much for having me today, for all the work you're doing and the interest that you have in this issue. And I know that we have a panel coming up that will be a Q&A panel, so we're happy to take any questions at that time. Thank you.